Okay, now we've talked about altered immune response, infection. So now let's talk about cancer. So cancer is a group of more than 200 diseases characterized by uncontrolled and unregulated growth of cells. So there are two major dysfunctions, a defect in cell proliferation and a defect in cell differentiation. So what does that mean? So what this means is that these cells grow and the body no longer recognizes it as that cell that it's supposed to be, either because of mutation or because of damage. So the next slide shows the development of cancer. So you have the initiation. So the things that can cause the cancer, viruses, hormones, for example, breast cancer can be hormone related, uterine cancer, ovarian cancer, when there's an imbalance of hormones that can cause cancer, radiation, chemicals, genetic factors, and then there's unknown factors. So all of these can be can target the cell. Then the cell is not itself anymore. So it becomes altered and it starts changing, okay? So it's kind of the old adage, tell me who your friends are, I'll tell you who you are. So you hang out with viruses and chemicals and you'll become something other than yourself. So what happens with cells? Well, cells replicate, right? They continue to generate. So the promotion, proliferation, so it keeps replicating, it's splitting and going further and growing. And then, so after that, with the progression, the final stage of the development of the cancer, that's where you may have the clinical manifestations. So we've heard about the immune system. So the role of the immune system is to reject or destroy cancer cells, right? So how would we might determine somebody that might be at risk for cancer who doesn't have clinical manifestations yet? We might see that on a routine blood count, CBC. We might see that their white counts are elevated or there's some depletion in some of their cells. Some cancer cells have changes on their surface antigens, so we might be able to see those for markers. Now, when we're talking about benign or malignant, think about the benign neoplasms. Oh, that slide is, it's neoplasms, not neoplams. So the benign cancers, they're not doing anything. They're just hanging out by themselves. They're kind of introverted. They don't really go out. They kind of stay with themselves. Okay, so they're usually encapsulated, which means they stay within their borders. They stay in their house. Okay, differentiated means they're normally differentiated. So like it might still look like, so for example, if it's a benign breast cyst, a benign fatty tumor, it like a lipoma is a benign fatty tumor. It still looks like fat. Those are cells that are in your fat cells, but it still looks like fat. Okay, it still looks like what it says it is. Metastasis absent, so it's not going anywhere, it's staying in its house. Rare recurrence, vascularity, slight, so it is growing. So how does it grow? With nutrition. How does nutrition get there? Through the transportation system. Which is the transportation system? Our blood, right? Mode of growth, it can be expansive. And the cell characteristics similar to the parent cells. Malignant, so it's rarely encapsulated. So malignant cells, they're your cheerleader, they're the most popular in high school, and they are in everything. They hang out with everybody, they're traveling, they're outside of their house. Poorly differentiated, the cell characteristics, so they, that's the other adage, when you hang out with friends that dress a certain way, you maybe start to dress like them. You may start to develop your friends' habits. So those cells may look like different. You might have cells that in the brain that look like the parent cell of the breast cancer. So it's, and that's in metastasis. So metastasis, malignant, that's capable. Vascularity, moderate to marked. So again, like these they are rarely encapsulated, right? They're really they're well, not popular in a good sense, but they're hanging out with everybody, so they are regularly using that transportation system. So some of this differentiation, the vascularity, that's used in kind of the staging. You guys don't need to specifically know the exact staging, but you will, you do obviously want to know the higher the grade, the higher the clinical staging, the worse it might be. So for those of you that were able to go to pathology, you may when you were in the surgery, perioperative services, and see pathology, you may be able to see how they stage, how they look at this growth. So they'll take a piece of tissue that's questionable, and they'll have a certain amount that they have to remove, certain amount of the border, to make sure to get all the friends in that border. And the patient may not be completely finished in that surgical procedure until they have gotten all their friends. Then that piece is sent, and they shave it, and they look, it's kind of like when you think about an MRI, where the MRI will cut it up and look at every individual piece. So to size it, to measure it, to see exactly that particular cell. 7 warning signs of cancer: change in bowel habits. So look at this as kind of like an acronym. So it's the change. It's any change. Prevention and early detection of cancer. So these are some of your risks. Limit alcohol intake. So this is for any disease, right? Someone should participate in regular exercise, maintain a healthy weight, eat the right amount of fiber, reduce dietary fat and preservatives. So this is prevention for a lot of comorbidities, right? Learning and practicing self-examination, teaching self-examination for women with for their breasts, with men for their for testicular cancer. Looking at skin, teaching a patient, oh yeah, I've had this mole all my life, but all of a sudden it looks a little bit different. Yeah, I spent a lot of time in the sun. Seeking care. Unfortunately, a lot of some skin lesions don't necessarily hurt. They might look funny, but if you're thinking about vulnerable populations, the vulnerable populations may not seek treatment until something hurts. So how do we test for these? We spoke a little bit. So to look at the lungs, bronchoscopy. To look at the colon, colonoscopy. To look at the stomach, endoscopy. And then you have your PET scans, tumor markers, genetic markers, bone marrow examination, chest x-rays might look for mass. A lot of x-rays might look for some masses. So what's the treatment of, the goal of treatment for cancer? So there's cure, control, and palliation. Cure, great. If it's, that would be ideal for everything, right? There might be certain areas where cure is not able to happen. For example, where the cancer can't be completely removed, or For example, in the brain, if removing the tumor really makes the patient unable to, the side effects of removing that are greater, the risks of removing it are greater than the possible outcome, they might remove some of it to help control some of the symptoms, or anti-cancer therapies might help. Palliation is really for quality of life and for relief of the painful symptoms or some other symptoms that they have. But the palliation is not cure. It can help with control. So you can look at this figure when you're looking at the treatment span. Role of surgery in cancer. So the surgery can help with diagnosis. The surgery can be helpful in palliation, for cure, for control. Goals of chemo. So for cure, these are common cancers that can be cured. They also there's chemo that is also putting people with breast cancer in remission. And of course, palliation for relieving pain, improving quality of life. Radiation is kind of localized, okay? So it's energy emitted to that specific area. External radiation or internal radiation are two different delivery methods. Common side effects of chemo and radiation. So this is important because these are the side effects that make persons not want to take the medication, and it's letting those patients make these decisions have them with informed decision making, where they're understanding the side effects, they're understanding the risks involved. Complications resulting from cancer, so malnutrition, and a lot of these are from maybe the cancer itself or from the treatment. Again, speaking with the patients on understanding all of these risks will help them. There is something called nanotechnology, which is another delivery method of a chemo. So chemo is systemic, right? So it's admitted in your blood, or you take a pill, and that's systemic. It goes throughout your body. So it may not it may not target just the cancer. That's why you have all of these other side effects, because that chemo is going through all of your other systems through your transportation system, right? Nanotechnology is a delivery mechanism that that the chemo gets on the boat, and the boat takes them directly to that cancer, so that hopefully there are less side effects. So think of like the nuclear bomb versus the Jericho missile in Iron Man. The nuclear bomb, you have all those other surrounding areas that are affected. With the Jericho missile, you can hit a camel in a desert, so without other persons. So it's more direct. And we're lucky we live in a medical center with a great medical center with a nanotechnology research center, lots of research on cancer and cancer therapies. So pain assessment and management with helping the patient should be ongoing. The patient is the primary source. Drug therapy is used to control pain. Fear of addiction is unwarranted, and it's also discussing with the patient the side effects of even that pain medication. The goal for that palliation would be quality of life, so that is determined by the patient and the family for support. And remember your non-pharmacological interventions, relaxation therapy, imagery, your complementary alternative medicine, therapeutic touch, lavender, those kinds of alternative complementary therapies. Psychological support is really needed for the family and the patients. There's lots of fear involved in prognosis, in family disruption, monetary, physical. So psychological support is really needed. Coping with cancer. How the patient copes with stress in the past is helpful. Faith is an issue. Past experiences with cancer, their attitude towards cancer. And so you're supporting the patient and family, your nursing interventions, being able to talk to the patient blatantly about what's happening, being honest, answering questions, being okay saying no if you don't know the answers, getting the right support, being an advocate, just like that ethical case that we did in class, being an advocate for the patient, knowing who you can talk to for support. So, all right, that is that. Thanks.